Okay, so this discussion is going to focus on the functional anatomy of the shoulder girdle. So when we look at the shoulder girdle versus the shoulder joint, we're looking in general in this kind of chapter section, we're looking obviously at both parts. We're going to break it up into the shoulder girdle and the shoulder joint. So the shoulder girdle, as you can see, is composed of the acromioclavicular joint, which is the articulation between the scapula and the clavicle. So you can see the AC joint is right here. Okay, you have the scapulothoracic joint, which is basically the articulation between the scapula and the rib cage, where that kind of moves over. You can kind of see it. It's a little hard for me to demonstrate with the pointer, but you can see the scapula right here. So it's basically that articulation between where the scapula kind of comes into contact with the rib cage, and then you have the sternoclavicular joint, where you have the articulation between the sternum and the clavicle. That's basically your shoulder girdle. Now, the shoulder joint, as you can see, is essentially your glenohumeral joint, or just classically what we think of as the shoulder. It's the articulation between the glenoid fossa of the scapula and the humerus. So again, in this talk, we're functioning on the bones, bony landmarks, and musculature of the shoulder girdle. And in the next talk, we'll get more into the shoulder joint. So again, the shoulder joint and shoulder girdle work together. So when you're moving your humerus and you're moving the shoulder joint, the shoulder girdle has to work along with that. Now, we're not going to get into like the biomechanics and everything. We'll talk about that in biomechanics class, how the shoulder joint and shoulder girdle have to work together with movement. But essentially, when you're moving your shoulder, your scapula has to move with it, okay, to kind of optimize your range of motion. So when we're looking at the functional anatomy here, we're primarily looking at the movement that occurs at the scapula. There is some movement that occurs at both the AC joint, or the acromioclavicular joint, and the SC joint, or the sternoclavicular joint, but really we primarily look at the scapula. And again, the movement of the scapula with the clavicle and the axial skeletons. Remember how we differentiate it between the axial skeleton and the appendicular skeleton. That's where this movement is taking place. And again, as you're looking at all these pictures, make note of the various bony landmarks, the ligaments that you're looking at, okay? Your textbook has some slightly different pictures, but again, as you're looking at these illustrations, make sure you're also noting, always be looking at the ligaments that are pictured, always be looking at the bony landmarks that are pictured, because again, the more often you see them in different pictures and different illustrations, the easier you'll be able to recognize them on models. Okay, so we look at the functional anatomy of the shoulder girdle, and as I say, on all of the pictures that I have on these slides, make sure that you're making note, always make note of all the ligaments, all the anatomical landmarks present, even if I don't necessarily mention them by name, okay? I mean, in the end, everything will kind of get talked about, but the reason why I'm saying that is the more you could recognize, again, all the illustrations are a little different, they're different than what's in your textbook, it's going to give you a better appreciation for the all the anatomical landmarks, all the soft tissue structures that you need to know. So you have the SC joint, that's your sternoclavicular joint, so it's the articulation between the sternum and the clavicle. You have your acromioclavicular joint, or your AC joint. Okay, that's the articulation between the clavicle and the acromion. So, and again, note all the different ligamentous structures around here as well. So you can see at the AC joint, you have the acromioclavicular ligament, you have the coracoclavicular ligament, and you have the coracoacromial ligament. Okay, so you have all of those structures there. All those are very significant. You know, when you hear the term separated shoulder, I'll kind of throw these little tidbits in every once in a while. When you hear the term separated shoulder, this is actually the joint they're referring to. Okay, so they're not referring to the glenohumeral joint when they say a separated shoulder. They're actually referring to the AC joint. If we look at the posterior, so we're looking at the posterior aspect of the rib cage, and that's another thing. Again, always orientate yourself to what angle you're kind of looking at. So, and you can tell you're looking at the posterior rib cage. because you can obviously see the posterior aspects of the vertebrae. You can see the posterior landmarks on each of the scapula. So again, we have the SC joint, we have the AC joint, we have the scapulothoracic joint. That's on the posterior, and that's where the scapula moves along the rib cage. So the scapula has to have movement along the rib cage in order to kind of optimize what goes on at the glenohumeral joint. So we look at the various bones, again, of the shoulder girdle. So here we're going to run through and talk about some of the landmarks on the scapula. So we have the spine of the scapula, okay? And here we have two different views. We have the posterior view and we have a lateral view of the scapula. So you can kind of see the spine from both angles, okay? So again, you orientate yourself to what you're looking at. So this is obviously a posterior view. This is a lateral view. They're showing you the anterior side, the posterior side. So you kind of get an idea, and you'll get to look at models in class. Again, always orientate yourself to what it is you'll be looking at so you could identify your landmarks real easy. And you should also be able to tell. If I give you a scapula, a bony model of a scapula, you should actually be able to tell me whether it's a left side or a right side based upon the orientation of the landmark. So you have to make sure you're able to do that. There's the glenoid fossa, okay? So again, a fossa is always some sort of cavity, usually where there's an articulation taking place, and that's where your humeral head articulates to actually form the glenohumeral joint. You have the coracoid process. Now, you obviously can't see the coracoid process on the posterior view of the scapula because it's essentially a structure on the anterior side. So that's why. So it's not an accident that there's nothing lighting up over here. You only see it over here because this is the anterior surface of the scapula. So you wouldn't be able to see that on a posterior view. There's your acromion process. Okay, so the acromion process is the structure that comes off of the scapula. You have the vertebral or the medial border of the scapula, and you have the axillary or lateral border of the scapula. Okay, so again, sometimes looking at these landmarks relative to where they are on it, you'll be able to tell whether you have that left or right scapula. There's your superior angle of the scapula, and then your inferior angle. Okay, so these are primarily all of your various bony landmarks when you're looking at the shoulder girdle, when you're looking at the scapula. Okay, here's just another view of the scapula and some other landmarks present. So again, you'll notice some different ones that we did not talk about. Okay, so for instance, you could see the neck present. So again, we look at all these different pictures. So here's an anterior view, here's a posterior view, here's a lateral view. Okay, so some of these we talked about and some of these we didn't. Okay, here we have the neck of the scapula, we have the scapular notch, we have the superior border. So the superior border is next to the superior angle. Here, as you come over to this other side, you have the supraspinous fossa. It's this little kind of divot on top of the, so think of the name, supraspinous, above the spinous process, okay? Or above the scapular spine rather, okay? Infraspinous fossa, okay? So we have some other landmarks present here that we didn't have on the previous slide, and a little bit of a different picture as well. Okay, here again we see, so if we look at this picture, you see you again have a posterior and a lateral view of the scapula. Okay, looking at the clavicle. Okay, the clavicle are what we commonly call the collarbone. All right, you have the big landmarks there. You have the body, you have the acromial end, which is the lateral side, and you have the sternal end, which is the medial end. Okay, the sternal end articulates with the sternum. If you come over to this other picture here, you could see, again, all the ligamentous structures that connect it to both the scapula and the sternum, okay? So you have all of your various ligaments. You have the trapezoid and the conoid. They're the coracoclavicular ligaments. We already talked about the acromioclavicular ligament, so that articulates there and holds that joint together. So again, and again, note all these other landmarks in relation to what you looked at previously. So we look at the shoulder girdle bones. It's important to look at this relative to the axial skeleton. So remember, we said the axial skeleton is the head, neck, and trunk, and we look at the spine, okay? And you can see the orientation of the scapula relative to the axial skeleton, okay? So again, here you can look. The axial skeleton is essentially shaded in blue. So you see those structures in here. So again, the skull, the spine, and the ribs, okay, along obviously with the sternum as well. So, and again, you see here, turn around to the back, you can see the orientation of the shoulder girdle relative to those structures in and around the axial skeleton. So we'll talk a little bit about the vertebrae, and this will kind of help you also for later on when we do talk about, and the reason why we're mentioning the vertebrae now, not that the vertebrae are necessarily a part of the shoulder girdle, but the muscles that attach to the shoulder girdle, or a lot of the shoulder girdle muscles, are going to come off of these anatomical landmarks. So that's why it's important to mention them now, even though it's not, you know, something that we directly deal with a whole lot in the shoulder. So again, we talk about the spinous processes. So the spinous processes are these little projections that come off the posterior aspect, and then you have the transverse processes, which are the little lateral projections. So you could see them here. Again, they're important to discuss now because when we talk about a lot of these muscles in the shoulder girdle, they're going, those landmarks in particular are going to serve as attachment sites for those muscles. So again, here's just kind of a picture kind of showing kind of general locations. So again, sometimes it's helpful to just sort of see, again, kind of looking at the human body to kind of get an idea as to where some of these landmarks are. So again, you look at these pictures, you could kind of see the trapezius muscle, you see the acromioclavicular joint, you see some different parts to how you could find the spine of the scapula, you have the deltoid muscle. So these are a lot of the, again, understanding the superficial anatomy, both from an anterior perspective and posterior perspective. So again, looking at the structures and the different joints, so we have the SC joint, the sternoclavicular joint, you have the costoclavicular and interclavicular ligaments. Again, you think about the names and where they attach. So the sternoclavicular ligament would be here. The costoclavicular ligament, you can see here. So costo refers to the ribs. So there have that ligament also supports it, and then you have the interclavicular ligament, which would just attach the two clavicle together. There's also a little disc at the sternoclavicular joint that kind of adds to the stability of the joint. The sternoclavicular joint's a very stable joint. It's not injured quite as often as the AC joint. You do have to be careful, though, with certain injuries. If you do get a posterior dislocation of the sternoclavicular joint, you have to be worried about the airway and the vascular structures in the neck. So that could become a medical emergency. But you don't see as many injuries to the sternoclavicular joint as you do in the case of a separated shoulder with the AC joint. So here's your AC joint. Okay, so you have your acromioclavicular ligament, you have your coracoacromial ligament. Again, think of the name and think of what it would attach. And then you have the trapezoid and the conoid. So the trapezoid and the conoid are your coracoclavicular ligaments. So coracoid process, clavicular, clavicle. Okay, so the trapezoid and the conoid are the two ligaments that support that side. So really the AC joint itself, the primary supporters. So if you just look at this, if you look at this region, okay, obviously the main stability points for the AC joint are the acromioclavicular and the coracoclavicular ligament, because they kind of support that ligament. The coracoacromial ligament is still a ligament involved in the complex, not so much as far as the overall stability. Usually most of your injuries when they occur here are going to involve these two ligaments typically. Okay, so when we look at the muscles, when we're talking about shoulder girdle movements, we're primarily looking at movement of the scapula. There is going to be some movement that takes place at the AC joint and the SC joint, but we're primarily concerned at this point with how the scapula is going to move. Okay, it's important to stabilize the scapula so that the shoulder muscles have basically a base of support to exert force for the moving humerus. So when you go to move your arm has a great degree of mobility. In order to have that and have it be safe and still able to deliver force through it, your scapula needs to be stabilized. So they contract to maintain the scapula in a static position when you're moving the shoulder joint, and they also contract to move the shoulder girdle to enhance movement. So when your arm is kind of more static or more force based, they're contracting just to kind of maintain the stability at the joint. And then when you're looking for movement and extreme ranges of motion, the shoulder girdle is going to move in order to kind of enhance that range of motion. So in other words, if your scapula didn't move or you just had the glenohumeral joint, your motion would actually be a little bit more restricted. You wouldn't be able to move quite as much. By allowing the scapula to move, that enhances movement at the glenohumeral joint. So when we look at our movements, so the movement of depression, that's going to be when the scapula moves downward, inferior, okay, or returns to normal position, okay? So when it returns from an elevated position, that's also considered depression. So you can depress from kind of your static position, but if the scapula is elevated and it moves back to the normal position, that would obviously be considered depression as well. You have scapular elevation. That's when the scapula moves upward or superior or shrugs the shoulders. So you see in each one of these pictures. So we'll go through all the movements and you'll get to see what they actually physically look like by looking at the illustrations. You have the movement of abduction or abduction and protraction. That's when the scapula moves laterally away from the spinal column. And then you have adduction or retraction when the scapula moves medially towards the spinal column, okay? So again, in any time there's more than one term to describe a movement, make sure you're familiar with both. And in this way here, you'll never get confused by, somebody using slightly different terminology. You have the movement of downward rotation, and that's when the scapula, the inferior angle, moves inferior-medially towards the spinal column. So you can see the movement of downward rotation there. That would also be kind of the movement of downward rotation would obviously occur as well when you're returning from upward rotation. So upward rotation is when the inferior angle of the scapula moves superior laterally away from the spinal column. And upward rotation is most commonly going to happen as you, or is going to happen when you elevate your humerus. Anytime you elevate, okay, or basically raise your arm, there's going to be a degree of upward rotation that has to take place, and that's just to maintain that stability, maintain the integrity of the glenohumeral joint as you're moving the arm through the range of motion. So again, shoulder girdle movements equal scapular movements. So all those different movements that we talked about, again here, we're just kind of putting them on a little diagram and you could kind of see how they're going. So again, we have elevation, we have depression, we have adduction, we have abduction, we have upward rotation, and we have downward rotation. So when we look at the muscles at the shoulder girdle, again, one of the, again, the big focus in this class, your learning objectives are essentially knowing all the bones, bony landmarks, origin, insertions, and actions of the various muscles. So there's 5 muscles primarily involved in shoulder girdle movements. Okay, so again, shoulder girdle movements equal scapular movements. They're essential in providing dynamic stability of the scapula, so it could serve as the base of support. Okay, so when we're looking at this, we're looking at that base of support. Shoulder girdle muscle rules. So sometimes it's a good idea to kind of learn some things to kind of help you remember, different aspects of the anatomy. They always originate on the axial skeleton. They insert on the scapula or the clavicle. They do not attach to the humerus or cause shoulder joint actions. So these muscles do not directly cause shoulder joint actions. They don't attach to the humerus. Okay. So these are your, so when you're recognizing these muscles, they all have these kind of basic general rules relative to what it is they do. Okay, so again, these are the 5 muscles primarily involved in shoulder girdle movements. You have the trapezius muscles, and they break down further into the upper, middle, and lower, and it's important to know the differences between the upper, middle, and lower because they do have some small differences as far as the movements they're responsible for, and obviously their origins and insertions will be different. You have the rhomboids, the levator scapula, the serratus anterior, and the pectoralis minor. And you can see on here, they're again just kind of showing you general directions. So they're kind of giving you an idea in the illustration in as far as what movements these various muscles will promote. So the pectoralis minor, okay, as you're looking at these, so these are the illustrations that we're going to be looking at to kind of show these origin insertions in action. So if you look over here, you see an actual picture of the muscle kind of teased out, and over here they actually show you, so here's the origin, here's the insertions, okay? So with the actions, and again, we're referring to movement of the scapula. So when you're seeing these movements over here, that's looking at movements of the scapula. So abduction of the scapula, downward rotation, depression. You have your origin on the anterior surfaces of the 3rd through 5th ribs, and your insertion on the coracoid process of the clavicle. Here you have the serratus anterior. Okay, so you can see a lateral view of the serratus anterior. Now this one could be a little tricky to look at the origin insertion. So the origin is the surface of the upper 9 ribs at the side of the chest. So you see the origin is all located along the ribs. The insertion is the anterior aspect of the whole length of the medial border of the scapula. So what they're trying to show you here, so this is obviously the lateral border here. So they're showing you the medial border of the scapula here. And then you have your motions of abduction of the scapula and upward rotation. So it protracts or abducts the scapula and also performs upward rotation. Okay, the trapezius muscles. Now remember, we have an upper, a middle, and a lower portions of the trapezius muscle. So you have your upper fibers, your middle fibers, and your lower fibers. So just to kind of show those here, they are kind of delineated, but it might be a little hard to see. So here's your upper fibers up in this region. You have your middle fibers in here, and then these would be your lower fibers. Okay. And again, if you think about, again, everyone's going to kind of learn a different way in as far as how to remember the muscles. But again, if you just think of general locations, it gives you an idea. Even if you maybe have trouble remembering actions, if you look at general locations and really think about it, you can usually tie together what it is you're looking at. So you have the overall origin and insertions of the entire trapezius, and then you have some of the actions. They tell you in the actions whether they are the upper and middle or middle and lower fibers, okay? So you can see, for instance, the lower fibers do depression, the lower fibers and the middle fibers do upward rotation, the middle and lower fibers adduct the scapula, and then the upper and middle fibers elevate the scapula. Here's the levator scapulae. So if you think about levator scapula, again, think of the name, okay? Levator scapula. So what's it going to do? It's going to elevate the scapula, okay? So you have the origin. This is why I said you have to at least have an understanding of the, and as you see this in some of the others, you have to have an understanding of the bony landmarks on the spine because a lot of these muscles will originate on the spine. So you have the origin on the transverse processes of the upper 4 cervical vertebrae, the insertion on the medial border of the scapula above the spine, and your action with this will be elevation. The rhomboids, okay, and again on the left side over here, you have the actual muscle. Over here, they're just kind of showing you relative to the origin and insertions. And the rhomboid muscle will elevate, adduct, and downwardly rotate. So if you kind of look at the orientation here of the rhomboid, so just think, again, it's going to shorten. So the muscle is going to shorten. You're going to have the insertion getting pulled towards the origin. So what would that do? It would adduct the scapula. It would also work with elevation and also work with downward rotation. Now, we didn't mention the subclavius muscle earlier. So the subclavius muscle is actually a small little muscle at the clavicle. You can kind of see it there. It does help to depress the clavicle. That's its primary function. You see the origin and insertion over here. So we didn't mention this muscle earlier because it's not a big muscle around the shoulder girdle, but it does help to depress the clavicle. And again, it's an easy one to remember. Again, as I say with anatomy, so a lot of times there's something to the name. So the subclavius muscle is just beneath the clavicle muscle, and you can see the other associated items here with the subclavius muscle. So the motion of scapular adduction. So I'm going to be doing this with a lot of the different muscles. So we go through the bones and bony landmarks, we talk about the motions, we show you the motions, we show you the muscles while still talking about their actions, and then we kind of bring them all together at the end here. So again, scapular abduction is when the scapula moves laterally away from the spinous process. Okay, so the agonist, so when we're talking about the agonist, we're talking about the muscles that produce the motion. Okay, so when we're looking at the muscles that do scapular abduction, the serratus anterior and the pectoralis minor are going to be the agonists to scapular adduction, abduction. Okay, scapula adduction. Okay, that's going to be a return from abduction, or the scapula just moving medially towards the spinal column. So your agonists are going to be your rhomboids, your middle traps, and your lower traps. Okay, are going to be the muscles that produce scapular adduction. Scapular upward rotation. So the scapular inferior angle moves superolaterally away from the spinal column. Your agonists there are going to be your middle trap, your lower trap, and your serratus anterior. Okay, so again, make sure you're seeing, and again, it's going to go a little bit beyond memorization. You'll probably use memorization probably as much, if not more, in this class than in any class you'll take. But you got to get a little bit beyond that because you have to be able to see how the muscle shortens and produces these actions. Otherwise, it's going to get difficult to remember a lot of things. So again, here you have your scapula upward rotation. You can kind of see the orientation of the muscles and how they would produce that movement. Scapular downward rotation. Okay, the inferior angle moves inferior-medially towards the spinal column, or it's essentially a return from upward rotation. So obviously, if the scapula is upwardly rotated, it has to downwardly rotate. So the agonists are going to be the pec minor and the rhomboid muscles. Scapular elevation, the scapula is going to move upward in superior movement, just like you're shrugging your shoulders. The agonist there, the levator scap, and the upper and middle trap. Okay, so you can see. Now, again, make sense of this. So think about why the lower trap wouldn't be involved in scapular elevation. So look at how the scapula is orientated relative to all this. So you see the muscles here, they would produce that elevation, whereas the fibers here, the way they run, they wouldn't produce elevation. Okay, so it wouldn't make any sense to include the lower trap and scapular elevation just based on their orientation. And then you also have the levator scap. Scapular depression, now we get into, well, we'll get to the muscles. scapula moves downward, or it just returns from a normal position. So your agonist there, your lower trap, so you can see where the lower trap would produce scapular depression and not elevation. And you also have your pec minor. The pec minor will also produce some scapular depression. Okay, so this kind of wraps up the shoulder girdle. Again, all your bony landmarks, you should be able to recognize and identify all of your bony landmarks and all your bones in the shoulder girdle. You should be able to recognize and be able to note all of your movements of the scapula, all the muscles, origin, insertions, and actions. Okay, so you should know all the agonists or prime movers to all of the different motions.